Welcome to This Show Is Not About Menopause, because menopause is only one day, so that would be a pretty short show. Hi, my name is Shirley. I'm the founder of Menopause Chicks and privileged to be your host for these important health conversations. This is where you will find quality information and key insights about all things women's health, the years before menopause and every year after. We are in for a treat today. My guest is Dr. Bal Pawa. When I was first imagining Menopause Chicks, I manifested getting a meeting with this woman. Over a decade later, it is an honor to sit beside Bal as she has taught me so much. And when she says yes to my invitations, and there have been a lot over the years, I still get goosebumps. Dr. Pawa is a medical doctor, a pharmacist, co-founder of the West Coast Women's Clinic in Vancouver, a Harvard-trained mind-body expert, a TEDx speaker, an author of The Mind-Body Cure, co-author of my first book, Mokita, a speaker, mentor, and my friend. Over the years, she has helped members of the Menopause Chicks community unpack sleep, stress, and sexual health, questions about hormone therapy, what we need to know about our heart health, alcohol use, and more. We are going to touch on a few of those topics today, so please join me in welcoming Dr. Bal Pawa to the show. Hi.
Hello.
Thank you for saying yes again. I have been manifesting this conversation for a long time.
Well, thank you so much.
How are you doing?
I'm doing great. I always love coming on your show because it's so aligned with my passion of empowering women, which is aligned with your passion. So together, I think we have a great synergy. So thank you for having me.
And I didn't include it in the intro, but you are a menopause expert. You're a North American Menopause Society Certified, which is now called Menopause Society Certified Practitioner.
Yes.
They've changed the acronym on us. And that is how I first learned of your work. So give us a little trip down memory lane of how you got to the work that you're doing today.
Okay. Yeah. So this is a great opportunity for me to kind of review where I've been and where I'm going, because it's a journey. As you know, women are always on their own unique journey. And my unique journey began in Burnaby. And I graduated from medical school, and I was always very passionate about women's health. So I started with obstetrics and gynecology. And it was a very busy practice, as you know, but focusing on women and their hormones, you just don't have the time. You've got crying babies, you've got asthma attacks, you've got heart attacks. You just could not have that conversation about hot flashes and aging, and it just wasn't happening. And so through my own journey, and I think you know my story, how I started the West Coast Women's Clinic, I discovered through my own health journey that there was a gap. There was a huge gap for women's health. And in particular for me, it happened because I had an injury, I had a car accident. But then as I was on that route to discovering health for myself, I said, there's a gap here. And when we think about hormones, we think about estrogen, progesterone, but there's way more to the picture. Yeah. And we have to look at the hormone symphony. And cortisol, which is your stress hormone, plays a huge role on the female reproductive system. And so I started delving into various courses and certifications. So, well, how can I get better? And I'm fueled by passion, as you know. And my natural curiosity, I have to get to the answers. I'm like a dog to the bone and say, okay, what's the root cause? What's going on? And that put me into the Harvard Medical School, studying with Dr. Benson, learning all about the nervous system. And then I studied with Deepak Chopra and then did my certification in the North American Menopause Society. So it's all just come together, and it's created a unique skill set of where I am today.
That is so amazing. Your work is so revered, but I want to go back to, when women find menopause chicks
Right.
and when women find the West Coast Women's Clinic, it's often after a journey of their own. It's not from lack of trying. They've maybe had conversations with their family doctor. They've maybe been on the internet. They don't just it's not step one,
Yes,
right?
You're right.
And you know what I don't think we talk about enough, and you alluded to it when you were, you had your own practice, is that doctors are frustrated too.
I can share that sentiment. When you think about our current healthcare model, Shirley,
our model,
it was designed. If you think about the Canadian model, I mean, the American model is similar, but the Canadian model, Tommy Douglas decided to create a model for hospital patients.
Yeah.
So it was for sick patients. It wasn't for wellness. It wasn't for preventative health. It was for sick patients. And so as the model evolved, the government started reimbursing doctors for a symptom. That's how we get paid, is you have one symptom and then that's your fee. And so the model has now been set up, symptom drug. How can we diagnose that patient in very short time, 5 or 10 minutes, and how can we quickly alleviate their symptom? So it's not going back to the root cause. It's certainly not holistic. It's certainly not integrative or preventative. So there is it's become a pill for every ill kind of a model, unfortunately.
Yeah.
And I mean, I love the Canadian healthcare philosophy of universality, accessibility, and all of that. It's wonderful, but it also lends to mediocrity. And when it comes to women's health, they get put on the back burner because there have been no studies done on women until recently.
Mediocrity and limits that I don't find we talk about enough in society. One of my passions is to prepare women for their next health conversation, show up as an equal team member, show up as informed as you possibly can, or with a list of questions. But that's not really what the model has supported or continues to support, right?
No, unfortunately, those conversations that need to be had with your physician are not happening. It's more, okay, what's your symptom? How can I quickly, fix it? Antidepressants, sleeping pills. So they're looking at your symptom, but they're not looking at, okay, what else could be going on here? And so the conversations, unfortunately, are not being had because they don't have the time or the resources. So I don't fault the doctors. I think their intent is good. I think the intention is to do the best for the patient, but the impact is they end up with polypharmacy and often not being heard.
Yeah. I mean, it's definitely complex. We're not sitting here today with the exact roadmap that will solve this or that, listeners can take for their own journey. But I know that just hearing you speak about it can maybe shift the paradigm so that, we need to remind everyone, don't fire your GP. Don't fire your family doctor just because they didn't learn about women's midlife health in medical school. And you're very familiar with the medical school curriculum.
The medical school curriculum is extremely broad. And as you know, as a physician, we're required to know so much about so many things. There's a lot of breadth, but not a lot of depth.
Right.
And so it is with menopause. We get a lecture on menopause. And then there's the whole unit of endocrinology, but everything is divided into compartments. Okay, there's menopause, there's diabetes, there's thyroid, but they're not looking at all the hormones as they work together. So there isn't that cohesive force. And certainly menopause health has not been highlighted. So most of our training that we get is after graduating from medical school, if you have an interest. They do have a women's health specialty for family practice.
Right.
So you can do a 2-year program, and part of it includes going through the NAMS certification program. So these are things that have happened in the last decade.
Which is amazing.
So this is good. So we have to think that medicine and care, it's an evolving model. And having conversations and creating awareness for doctors, creating awareness for patients is something that is a process, and you're sort of the catalyst for that process, but it is an ongoing conversation.
Can you help us understand, if you are a physician who has an interest in women's health, and I know that there are many who do, how does that actually play out in the model that we were just speaking of? Because they graduate and then they go and work in a model that rewards them for 10-minute appointments.
So this is so interesting because just yesterday, I got approval to create a preceptorship program for practitioners, so nurse practitioners and doctors, that will be an accredited program, hopefully through the colleges. And I'm going to do it in such a way that we'll take all the teachings from NAMS, which is all about keeping women safe, about estrogen and progesterone, but also include a lot of my own 30 years of women's health experience and put in how important the mind-body connection is, how important the functional medicine, how about the gut, how about, looking at autoimmune diseases and how they manifest after menopause, and why do women get more autoimmune diseases than men. So looking at the gender differences, but also having the credibility, but holistic, integrative approach. So it's going to be a very unique product. And then, more exciting, we're going to, so that'll be for practitioners and doctors, and then we'll have a subset for menopause coaches. So anybody who's interested in teaching, and they have to pass an exam,
registered dietitians,
massage therapists, nutritionists who are interested in women's health, but then can educate women on a greater level.
Pelvic floor physios.
Exactly. And have the certification that they need, so the information is credible, it's consistent, it's standardized, and it's evidence-based.
This is really good news. Really good news. It's really drawing a line in the sand, I think, from where we were and where we are going, and the culture and model that our daughters can grow up in, which I think is super exciting. Right?
I absolutely agree. And I'm really glad to see that you changed this. You said cracking open the conversation. You did crack open the conversation. And now you're in the process of modifying and changing the conversation to empower women to make better decisions for their health, right? Yeah. We have so much information out there. It's not that there's a lack of information. Women can get that.
No.
But what information applies to that individual? What risk, what benefit? And it's all very individualized, and personalization of that information is the key. And that's where menopause coaches and practitioners can work together.
Absolutely. Absolutely. Yeah. One of our conversations a couple of years ago focused in on heart health. Yes. And I wanted to bring that to the top of our list today, because heart disease and stroke is one of the glaring statistics that our generation is facing as we go forward. And there still exists a gap. We show up at our health appointment and we have those immediate concerns. And yes, quality of life now is super important, but we're not getting coached or getting the information about being preventative with our cardiovascular health. So what message do you want to leave us with around the topic of heart health?
Well, it's certainly a very important conversation, because women often, if you ask them, what is your biggest fear? They'll say breast cancer, right? But that's not the number one killer. The number one killer is still heart disease. And when we speak of heart disease, we're talking about stroke, heart attacks, anything to do with the vascular.
And we're talking about premature death, right?
Yes, and premature. And women are somewhat protected while they're menstruating.
Yes.
So you rarely will see a woman have a heart attack while she's menstruating. Isn't that interesting? But after menopause, her risk for heart attacks and negative outcomes from that heart attack are actually higher than men. And there are a number of factors we have to think about. We have to think about the anatomy. Our heart is different. The coronary artery distribution is different than men. So there is a difference in the size of the heart, the distribution of coronary arteries, and so our symptoms are different. And so women will often overlook their symptoms. You've seen the commercial where the woman's having a heart attack, but she still has to do the vacuuming and do the laundry and get the kids ready because she doesn't have time to sit down and address her symptom, right? You've seen that.
Yes.
I think Rachel McAdams was doing that one. And it shows that women often leave their symptoms because they think, oh yeah, it must be a muscle spasm. They minimize it.
Right.
So there's a problem with women, but also a problem in the emergency room. When they get there, they were often dismissed and they were minimized. And so emergency docs have now been trained that when you see a woman and she's having indigestion and she's not having squeezing central pain, that it could still be a heart attack in a woman. And so we're teaching doctors how to recognize female specific symptoms.
Right.
And we're teaching awareness to women that they also have to advocate for their health and stop and learn about the risk factors for heart disease. I think it's knowing your risk factors.
Knowing your risk factors. And I think you taught me this as well. It's like, that? So now I'm going to jump to hot flashes for a second, because hot flashes is what, media and Dr. Google equate with menopause. And it's probably not surprising to you, but I don't even talk about hot flashes that much. Most of the questions I get are not about hot flashes. But when I do talk about hot flashes, I want everyone to realize that it's like a check engine light. So yes, you might be able to tolerate them, but it's an invitation to get to your doctor, because then if you're 51, 52, 53, you have this opportunity to be preventative around your heart health. And this is about connecting those dots, right?
That's a really great, connection point for women to know. And as a physician, when I opened the clinic too, many years ago, hot flashes were a nuisance,
Sure.
right? Women said, well, it's really bad. I'm in the middle of a conversation in the boardroom and I get this sudden, heat. And when you look at the anatomy of a hot flash, what is it? It's a vascular event.
It's a vascular event. Vasomotor symptoms.
That's right.
Yeah.
So then it's more than a nuisance. And now that research is being directed for women, menopausal women, we're starting to say, hey, wait a minute. When a woman has a hot flash, let's connect her up to the EKG machine. And we saw that there was a change in the heart rhythm. Let's connect her up to an EEG machine. And then we saw that there were changes in the neural circuits and the brain waves. So this event that we thought was a nuisance was actually a prodrome and a predictor of future vascular events. So we now know, no, we have to treat those hot flashes because they're not just a nuisance. They could be prodromal, or what we call messengers or harbingers of future cardiovascular health.
Wow. Yeah. Wow. You alluded to this new course that you're doing for practitioners, which is super exciting. Take us into your practice though. What is a day in the life like at West Coast Women's Clinic?
I absolutely love what I do. So there's a Japanese word called ikigai.
Yes.
Ikigai is, knowing is the essence of who you are, and your purpose, your perspective, and your passion are all aligned.
All the circles come together.
And I think I'm so fortunate, and I feel so grateful to be in that ikigai, and you're in that space. And I always invite women, there's a great book on ikigai, to find their ikigai. And in my space in the clinic, what I love is that women come in, and I know that when they leave, they're going to be transformed. And they're transformed because we do a comprehensive risk assessment. So their intake is a very comprehensive questionnaire. So they get their questionnaire. Then they get a physical exam, which now women said the doctor won't even do a physical exam because they either are not allowed to have physicals or they're not allowed to see the doctor in person. So I think it's so essential to do the physical exam. And then there's the diagnostic component. We do blood work. And we do the hormone testing.
Right.
So when I've cast out the big net, I'm not just saying, okay, is this woman, what is she going to need a drug? I'm looking at everything. I'm looking at their genetics. I'm looking at their quality of life. That's so important. I'm looking at their lifestyle. Are they smokers? Are they sedentary? I'm looking at a whole big picture. And by the end of it, when I cast out the big net, what I've got is a very personalized health plan for that one woman. And as I execute it with my health coaches, we have health coaches that are trained with me to help me execute the plan, the nutrition, the lifestyle, the mind body, the mindfulness. So we give them what they need. And then you see them, and the transformation is so rewarding because that woman becomes empowered, she becomes healthy, she graduates from the program, and then I love the ripple effect.
Tell me about the ripple effect.
Positive ripple effect for women. And as you know, we converse. Women are collaborators.
Yes.
They want to help each other.
Yes.
Men will golf for 4 hours on the course and not talk about their prostate or the fact that they're going through prostate cancer. They won't mention it.
Yeah.
They feel vulnerable. Women are so eager to help each other. I see women having conversation in my waiting room. They're complete strangers. And next thing you know, they're talking about low libido and vaginal dryness. And they're not afraid to communicate, be vulnerable, and help. And that's really important about women conversations. So the ripple effect is a positive ripple effect because one woman, when she feels empowered, healthy, informed, then her family is going to be better. Her friends are going to be better. And women are nurturers. They're caregivers. So the ripple effect just extends out further. And as a physician, I mean, how rewarding is that to say, okay, I helped one woman, I taught one woman, I transformed one woman, and now she's transformed many others. So it's a beautiful thing to wake up to every day knowing that, you know, you've helped to change lives. And that's my drug of choice is helping others to change their lives for the better.
That is so beautiful. And future generations too, because as we change this conversation, it is going to have the ripple effect for future years too.
Yes, for daughters, our daughters and their daughters. Yes, I agree.
Amazing. Amazing. What's the question you get asked the most?
The biggest question, I guess, would be, it's still about hormone therapy.
I knew you were going to say that.
It's all about the fear that was, just embedded into the minds of doctors and patients alike back when the WHI report was released, did so much damage for women's health. It every day I'm undoing the damage because I'm scared of hormone therapy. And when I go through the risk assessment, I teach them, here are your risks for heart disease, your breast cancer, your bone health, your brain health. So we look at the whole picture. And what's really interesting is they're so scared of hormone therapy and the risk associated with it for breast cancer that they don't look at what is the risk with having 2 glasses of wine a day. The risk for breast cancer is much higher.
Yes.
But often that message is not communicated, right? So the message about hormone therapy is so embedded. I have to unpack so much. And I'm happy to do it. But I think women need to get more information about all the other risk factors as well.
Yeah. So when we wrote Mokita, which was back in 2018.
Oh my goodness.
I did talk about, hormone therapy is very individualized, how important it is to work with an expert and the risk assessment. But I've since changed my language around that. And I want to make sure that every time I say risk, I say benefits versus risk.
Yes.
Because we are potentially doing a disservice to women if we only talk about something that has risks. Everything has risks. I took a risk driving to the studio today in my car. But the benefit is that I get to sit with you and work with these guys. So, there's a benefit and a risk to every decision that we make. So let's talk about some of the benefits.
Well, let's talk about the benefits because that's so important. I divide it into 2 things. I talk about short-term benefits.
Okay.
And I talk about long-term benefits. And before I do that, I preface it with this. Look, women and their ovaries, they're on a timeline. We've heard about the biological clock, right, for reproduction. But our ovaries are designed to last a certain amount of time. And if you look at the turn of the century, We died when we were around 58, 60.
Right.
So our ovaries would stop functioning around 51, and then you spend 8 or 9 years in menopause. We're now spending 30 to 35 years in menopause. Women are outliving men.
Yeah.
But our reproductive capacity means our hormones decline. Hormones are very powerful chemical messengers. When they dry up, we age very prematurely, right? You take a 30-year-old, take out her ovaries, watch her aging process. Her bones will age, brain will age. So when we talk about closing the gender gap, it means that if we're going to have women living for 30 to 35 years after menopause now, they fill up our nursing homes with dementia and osteoporosis. If we can give them long-term benefits to prevent brain loss, brain atrophy, and prevent bone loss, then that is a huge way to close that gender gap between men and women, because men produce hormones till they die. Women, we have a limited capacity. So that's a long-term benefit is looking at bone health and brain health. The short-term benefit, look at this. When the WHI report came out, that study, the prescriptions for antidepressants, sleeping pill, and painkillers went through the roof because women were stopped having hormones. So what do hormones do? They create a better sense of quality of life. So we have a quality of life questionnaire. What is quality of life? Energy, mood, vitality, lack of hot flashes, vaginal, dryness is helped. So all those things that hormones do in the background, because they improve your quality of life. So those are the short-term benefits, and then you have the long-term benefits.
I love it. I love it. I love giving that message every single opportunity that we have. And I think it's like the number 2 reason for being admitted to long-term care is incontinence.
That's another one. And we didn't even talk about that.
Yeah.
That's a long-term benefit as well. Is
vaginal
it's
and
called
urinary
GSM,
health.
genital urinary syndrome of menopause. And that's, a lot of women don't talk about that.
No. And I was just listening to someone talking about caregiving the other day. And, it was kind of like a general statement, but it's like our generation is prepared to look after our parents. We will, we'll book their doctor's appointments. We'll, help them age in place until incontinence becomes a barrier. And then we're kind of like, okay, time out. We're now going to look for long-term care so it's like, it's robbing independence of our seniors and elders.
The dignity and independence, but also, you cross that line between the parent-child and the parent doesn't want the child, even though they're adults, to be, taking care of their toilet care. It's a real problem. And hormones, what estrogen does specifically to the vaginal epithelium is it helps not just with sex, but it helps with bladder control. It works on the urethra and all the mechanisms of the bladder to prevent incontinence. That's a big one.
Wow. It is a big one. Okay. So many topics to go through. I know you've got your practice. You've got a lot of other initiatives that are very, very exciting coming up. I'm looking forward to following that. What's one thing that needs to change systemically or even in the conversation? What do you really want us to focus on?
I think the biggest thing I would say is that there's so much information out there, and I just want women to get good information, good credible information that applies to them, that's pertinent to them, and is backed by studies, science.
Evidence-based.
We still have to, as much as we say we don't want evidence-based studies in everything, I think it's so important still to have the credibility and the science behind the conversations. And that's why I applaud your efforts, because you will go out of your way to find the people who are, in the know, and they're not just spewing out information. It's information that's backed by science. And I think that's so important for women.
Amazing. Okay. So we haven't even touched on stress and the mind-body cure. So I hope you'll stay around so that we can continue that conversation.
I would love to have that conversation.
Thank you.
Thank you for having me.
Thank you for listening. I know you have many options for where you spend your time, so I am so grateful you chose this show today. To learn more about my guest, Dr. Bal Pawa, please visit drbalpawa.com and check out all her details in the show notes. And if you enjoyed this episode, please subscribe, like, do all the things, and follow me on social media at Menopause Chicks. I'd like to say a big thank you to the folks who support this show and share my mission for women's health: Vichy Laboratoire, FerroPro Iron, Feel Amazing Vulva and Vaginal Moisturizer, and Intimate Wellbeing. You can learn more about those organizations in the show notes as well. Plus, a big shout out to the team here at Oh Boy Productions. And remember, someone you know needs this information. Maybe it's you, maybe it's someone you love. So thank you for sharing, and see you next week on This Show Is Not About Menopause. I want to give a big shout out to the pharmacists at FerroPro Iron who have been contributing education and health solutions to members of the Menopause Chicks community since 2018. What I love about FerroPro is that it was formulated by Bob Mayer with women in mind, which means it's gentle yet effective, and it will not cause stomach upset or constipation. What I want everyone to know is that common signs of iron deficiency can include fatigue and exhaustion, hair loss, cold intolerance, brain fog, heart palpitations, and restless legs. And if you still have a period or eat primarily vegetarian, please have your ferritin levels checked. Learn more at ferropro.com or order today at purepharmacy.com/menopause chicks.